Good afternoon. I want to welcome you to today's webinar. My name is Dr. Eric Toring. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine. And the webinar today is sponsored by the ACVPM and its partner organizations, the National Association of Federal Veterinarians, the American Association of Food Safety and Public Health Veterinarians, the U.S. Animal Health Association, and the National Association of State Public Health Veterinarians. I would like to introduce today's speaker. Dr. Kevin Jacques is a 2016 graduate of The Ohio State University College of Veterinary Medicine. He practiced mixed and large animal medicine in private practice for 5 years, both in Ohio and Washington State. His special interests include antimicrobial stewardship, farm management, nutrition, and milk quality. Dr. Jacques is currently an assistant professor at The Ohio State University in the Department of Preventive Medicine's large animal ambulatory clinic in Marysville, Ohio. He teaches senior veterinary students during their clinical ambulatory rotation and in other relevant courses. Dr. Jacques is a member of the AABP, AVMA, AASRP, ARPAS, and ABC. He is the current chair of the AABP's Committee on Pharmaceutical and Biological Issues. Dr. Jacques also enjoys any time away from work at home with his wife, Ashley, and their two children, Margaret and Ambrose. I will turn it over now to Dr. Kevin Jacques.
All right, so let's get started. And thanks for the intro and thanks for having me here. And we're going to talk today about on-farm antimicrobial stewardship using a systems approach. And maybe some of you know what that is, maybe some of you don't. Maybe you work on a farm, maybe you don't anymore. So hopefully this is a good overall coverage of what you might expect to learn about antibiotic use on a farm today, especially in the United States. So we're going to go through some definitions, and then we'll talk about what a systems approach is. And then we will define some current uses going on in today's industry. And then we'll talk about some areas for improvement and how a veterinary practitioner should play a role in antimicrobial stewardship. So let's talk about some definitions and a few of my thoughts and the impetus for why we should really discuss this in overall. So a lot of people have heard the term antimicrobial stewardship, but I thought I would give you some definitions and clarification. So stewardship is the offices and duties or obligations required of a steward, but today we really mean more of something that we're caring for and managing. Everyone remembers that an antimicrobial is a compound that destroys or inhibits the growth of a microorganism. And we're usually referring to antibiotics, but just remember that it also includes antifungals, antiparasitics, and some other product compounds. The AVMA has an official definition on their website. If you're an AVMA member, you can find that. Even if you're not, I believe it's open to you, but I've written it here for you. And that would be that antimicrobial stewardship refers to the actions veterinarians take individually and as a profession to preserve the effectiveness and availability of antimicrobial drugs through conscientious oversight and responsible medical decision-making while safeguarding animal, public, and environmental health. So all of us like to have very comprehensive statements, and I think that's a pretty good one. And the AVMA has some further details to that. So they parse that down into different core principles for antimicrobial stewardship. And the first is commitment to stewardship. So actually agreeing to acknowledge there's a problem, acknowledge that we need to do something about it. And then we want to build a system to prevent common diseases and to take care of those. And then we're going to select and use drugs properly, and what we commonly say is judiciously. Judicious referring to in a law-abiding manner usually, but also in an appropriate manner, both for the animal, for the client, and for our public health. And then we're going to evaluate antimicrobial drug use practices. Usually that involves referring to our data that we acquire on farm, Are we evaluating them based on protocols and such? And then we always want to continue our education and educate others about antimicrobial stewardship, which is their final core principle. And you're welcome to look at those online. But my personal thought, I thought I would simplify it to you. And that really makes me feel a lot easier because I'm originally a farm kid at heart, and simple things get done a lot easier than if you try to complicate it. So, what I usually say is we're doing the right thing at the right time with the right product under the right knowledge conditions. And that's referring to when we're using those products. It's a little simplistic. It's not quite as fancy, but I think it gets the job done for what I'm doing on a day-to-day basis. I'm still going on farms. I'm still treating our normal clientele. We see just about any other species you would think a large animal practitioner would see. And so I think that covers the job for what needs to get done. But really, what is the actual prod that would poke us in the bum and say, why do we actually care? Okay. What is the important part about antimicrobial stewardship? And a lot of you probably are aware of this, but I thought I would emphasize that we want to provide a wholesome product, maintain our veterinary oath, and I can read part of it here if you would like. But I'm sure if you're a veterinarian, you remember that taking the oath, it's in there about animal health and welfare, prevention and relief of suffering, conserving resources, public health, and advancement of knowledge, and trying to be ethical about it. We also want to protect our food supply and our consumers, and we want to manage and maintain environmental health and advocate for policies and laws to ensure that we can continue to do all of this for the benefit of our patients, clients, consumers, and the policymakers, because they're also consumers too. So that kind of sounds like the 5 main principles of ACVPM. And so I thought that's a pretty important topic. But we want to make sure that we're using these drugs appropriately and we still will have access to them in the future. So let's talk about the systems approach. It's really been around for quite a few years. It really started popping up in literature in the mid 20th century as far as an actual system or a way of thinking. The systems approach has really started in engineering, and then healthcare systems started to apply it to their situation. And then so it's kind of evolved from there. There's what a certain author in 75 said systems approach is essentially a way of perceiving and thinking through a problem by identifying and focusing on the critical elements pertaining thereto. In other words, in order to apply systems approach, we need to know about the nature of the problem and what kind of problem we are dealing with first. And they go on to explain things about engineering and how engineers like to think in little pieces, but you need to think of it as on a whole. And so we really tried to mirror this in healthcare. And here's a more recent article, so 2018, in this century, if you would like to think about it that way. But healthcare is a product of complex adaptive system of people, equipment, processes, and institutions working together. And so the author pointed out 2 questions emerge when you think about this approach. What can we do better, and what could possibly go wrong? And that kind of reminds me of my 4-H kid oath when I was in 4-H club, how we to make the world better. I think it's part of that, something to that nature. But that it's really a good thing to think about overall. We get into our mundane tasks of doing everyday things, and we kind of forget why we're here and what we really need to accomplish in the long term. So always trying to think about the whole big picture. And we're going to apply this now into antimicrobial stewardship. Here's another few images from that article in 2018. And I thought these were really nice because it really explains or it gives you a good, nice big picture of the whole system on a large scale. And what is our problem? Where is it coming from? What system is it affecting? And what are the parts of the system? Who is there? What could go wrong? What do we need to do? all of that really plays into the effect of how we're going to accomplish something. And so there's another on the right side of the screen is this other image of a corkscrew. And it's really basically if you're a clinician, you would recognize this pretty quickly about someone comes to you with a problem, something gets triggered, then you try to understand what's going on and maybe do some diagnostics. You try to figure out how to compensate for the problem, and then you kind of fine tune it. And then you get down to the end of the corkscrew and you've become efficient about treating the problem, and now it's actually really better. So we need to apply that to stewardship and think about what we're doing in the whole system on our farms. So let's talk about some current use practices within North America, specifically on our food animal production systems. So what are we currently doing on our farms? There's really a lot of variation. It could depend on the size of the production, or the species is really going to dictate how things are handled. There's a lot more efficiency, as we probably know, in the poultry and swine industry compared to cattle, and especially to the small ruminants. So there's a wide range of things, and maybe as a practitioner, you would recognize those based on your clientele, how you need to handle each individual client. But if you're someone like me, we see various sizes of production systems, and so we kind of need to understand which way to handle each of those. And really, it's just going to come down to which way should we handle each client or owner or management team, just to get stuff accomplished. But there's really big differences between those species. As we know, there's food and water and injectable, and there's occasional and topical antibiotics used. But there's going to be a lot of differences between those species as well, how those are individually used in their different routes of action. There are some regional differences, but I don't think it's as a big of a player as like the new and upcoming thing will be the backyard growers or backyard producers. So it's becoming very popular, especially in my area, about homesteading and growing their own food, and that's really going to play a big deal into the future. And it's kind of something we didn't really talk about because we were taught, you know, farms are getting bigger and we're going to need to be more efficient and learn how to manage people. But we're kind of getting both at the same time. We're also going back to individual animal care as well. So that's going well, I think, but it's going to be a new challenge for us in the future. So current use practices today, how are products labeled for treatment, control, prevention, and reduction? And there are a few still left that are labeled for growth promotion, but not very many. And that would depend on the route of administration and the type of product. But if we're thinking about antimicrobials, specifically, there are injectable, oral, water, and feed routes. And so I thought I'd give us some few examples. So a good example of how we're currently seeing antimicrobials used. So let's say we have a dairy farmer that is treating a cow for pneumonia, a lactating cow, and they use a ceftiofur product and they follow the label. That is a great use, very well done. They identified an animal that has pneumonia, has respiratory disease, and they identified a product that has a label for that specific indication, and then they follow the label requirements. Specifically, we've got to remember ceftiofur has restrictions, can't really go off label unless you change only the indication. Still have to follow the remaining regimen on the bottle. And here's a bad example. Someone decided that their goat had some babies and now it's got an infected uterus. And they decided to use ceftiofur crystalline-free acid, which is Exceed, in a goat for metritis. This is technically not allowed, even if it is a minor use species, and that's because there is a ceftiofur labeled for goats, which would be ceftiofur sodium. So that's a bad example of using antimicrobials in current use, and I've seen that before pretty recently. And usually there are people that have had animals for a long time, but they don't understand the changes in the laws and the regulations. And so we have to explain that to them. I always like to pull out my Baytril for calves for diarrhea because I think that's just a very classic case of ugly use, I consider. And usually the producers might have records that label it as pneumonia, but they were actually treating the animal for diarrhea. If you follow ABP, we might be having some future documents out soon about treatment of diarrhea or prevention of diarrhea and such. And you'll notice that most diarrhea in calves is viral, especially in the early stages, but it really depends on what the agent is, if you are going to use antibiotics and if they're actually appropriate or not. Um, so yeah, that's the ugly one. No Baytril and diarrhea calves in the United States, at least. In other countries, it would depend on the what the veterinarian says. Some other current uses in the United States, we have implemented the VFD product rule changes that started in 2017. And I think overall it's going well. Um, I still get some pushback from producers about, having to go out and visit the farm. They have to have a VCPR, they have to have veterinarians of record, um, and they have to see us and we're like, why are you charging me for a visit just so I can go buy antibiotic for my feed. Well, one, because the government says so, and two, it's so that we can have a good relationship if we think this is the best way to handle your case and really think about your system of production. Is that actually appropriate? And I think some that when the VFD changed, there also some water medications became prescription based, and so that was really helpful, I think, in seeing how much was actually getting used. And what I think we really saw, me personally, was that we found some people were using VFD product, and then they're like, "Oh, I don't want to do the paperwork. Can I do water?" But then they found out that water treatment might not work or might not be the best solution for them, depending on their species. It works great in certain species, but not always going to work well for every species. So other things that we currently do now, obviously in the last year, it started in June of last year, the FDA removed over-the-counter status for most antimicrobials given over the counter. And that I think is going well. There are some clarifications that a lot of clients needed to have. And a lot of clients also probably didn't have a VCPR that was technically up to date, depending on your state's rule. And so we personally are seeing that we have to explain that a lot to people that don't usually call a vet and just raise a few animals or raise a lot of animals, but don't usually have to call us for that kind of thing. So that's kind of what's going on at the moment. So let's talk about the whole system on a whole. It's really a very complex system, and I tried to simplify it down to kind of get rid of the species effect, but it's really dependent on species, so it's really hard to say how does the whole system get affected by any particular action item. And so we really have to think about there's a farm and then there's an owner or an owning team or such, and they have facilities, and the owner also has a family, or the management team has family involved as well. Maybe they're on farm, maybe they're not. Most farms employ some kind of employees or personnel. They might not have many, but they might have at least one. Like people like to go on vacation, so need to have time away. Um, but there's also these great confluence of involvement here. And a lot of these also might have feedback. And I probably missed a bunch of connections because I kind of got overwhelmed with how much everything kind of fits in together. But if you're thinking about the whole system, we as veterinarians usually have some effect on or directly on our animal populations. We have direct effects on the owner or the management team. And then we have some minor effects on consultants and other people involved. So it really gets pretty convoluted. We are in charge of drugs, so we tend to have a good close effect to that. And drugs can go into feed or water or directly into animals, which I forgot it looks. And we also work constantly with a nutritionist, or if we're working for, say, a poultry production system, there might be a nutritionist on staff with us that's working on the same team. And we might have field representatives that would be consultants on the farm too. There's a lot of variation in weather, especially if you're where at, and I am in the Midwest. Weather goes up and down every day. We have 4 seasons in one day sometimes. And so weather really plays a big involvement on how our animals are feeling, if they're eating well, if their dry matter intake is up or not, if the barn system does not compensate for the change in weather quickly. Are animals getting stressed? Are they getting hot? Are they getting cold? Those things really play an important role on our disease expression. And so then we also will have feedback on external diseases due to weather, such as winds blowing in, say, high path flu, or even like midges or something bringing in like EHD or blue tongue or something of that nature. So those are all well connected. And I'm sure a lot of you know this, but you haven't thought about it on a whole big picture. Everything kind of fits together. But if you cut one of these out, you can really cause havoc to the system. And so if you're going to implement changes into that system, you really need to think down the road, where is it going to change and what is it going to change? And where might I have some stumbling blocks along that way? And I think that we're doing a pretty good job overall, but we have some room for improvement. So there's if we think about some examples, I like the good, the bad, and the ugly. I think it's just easy to parse out things like that. So let's just think about, I'm very familiar with cattle the most, so we'll use some cattle examples. But how about antimicrobial use on farm? What does it look like? Maybe computer will go. All right, there we go. So there's an employee or a veterinarian drawing up some drug. I think this looks pretty good. This is just a picture I found on Google. So honestly, you can Google a lot of pictures. The bigger challenge in the future is going to be determining if it's a real picture or not, if it was AI generated or not. So we'll have to figure that out eventually. But this seems to be a real picture to me. They're drawing up a product. They're using a reusable syringe. It seems to be an appropriate needle. It's an old school needle, which is a reusable needle. It looks like it's not a plastic hub. So they obviously don't care about cost. Just a joke. Um, but I think it looks fine. If I was to really be nitpicky, why do they have a glove only one on one hand if they wanted to wear gloves? Just seems kind of odd to me, unless you're reminiscing about the 90s and Michael Jackson. But I think this is a good example. Whether or not they're treating the animal in the background is the real question. Not great restraint on the animal as far as I can tell, but maybe they do have an appropriate knowledge of what's going on. Obviously, they're there and I'm not. Here's an example from one of our clients that a colleague shared with me. And I we're talking about stewardship, but it really, this is still connected. So this is obviously, these are syringes that are being reused over and over again. And some are for antibiotics, and some are for NSAIDs, and some are for vaccines, and some are for hormones. Um, why why they have this shelf, I don't know. It's not really necessary. Plastic syringes are meant to be disposable, so that's not ideal. And these needles are also meant to be disposable. If you're in Ohio, you're really starting to worry about anaplasmosis and even tylaria. So reusing needles really isn't ideal. If you're a cattle producer, you should really worry about, bovine leukosis virus. Those are still things we think about. I thought an example of something going on that's not great. I'd probably call it bad. Is it going to get fixed? I don't know. It's not really necessarily a priority yet. I will, on a case for me, I usually mention these and be like, hey, can we not do that? And usually I get a shrug of shoulders. Um, but sometimes I'll be really picky about it. But there might be bigger fish to fry in the basket here. So it's just, I don't know. You have to think about, is this exceed syringe going to even syringe after it's sat there? Exceed tends to wear down on rubber a little bit, so that's a little of a problem. Also, how much bacteria is growing in these things that's going to inhibit the actual effectiveness of the next product to be drawn up into it. Those are all concerning things. And if you're not getting an effective dose of product, is that actual stewardship? Um, I like to call this an ugly version. I blacked out where I really got this picture from, but this is still an antimicrobial. It's a drug for treating coccidia and some other things, especially in horses. We might use it for EPM, but it's really not fun to see this, especially when it's on a goat farm. Yeah, just not great. So I like to call this an ugly version. And I think a lot of practitioners will be familiar about the challenges with this, oh, well, I just got this offline and it didn't ask me for anything and they sent it to me and it worked great. And now my goat's coccidiosis has gone away completely. And well, it probably has, but was that a responsible use of that drug? Probably not. But I think it could have been a lot better. Um, So there's a lot of issues still out there. We still have things to get to, but I think we could get better. And I think we are slowly, but there's always going to be a problem somewhere we need to fix. Computer go. So some of the industries have really taken a good stance in combating bad uses of antimicrobials, and they've taken a really proactive approach. So I thought I'd give you some examples of some of the veterinary industry um, statements and guidelines out there. The AABP and ABC have a joint judicious therapeutic use of antimicrobials in cattle guideline, and the AABP has a drug use guidelines for bovine practice. And we have several other documents relating to certain specific antimicrobials or other antimicrobials for specific uses. Um, the swine veterinarians has a judicious use in raising pigs without antibiotics. Both are great statements and they're very similar to ABP. I think we understand the challenges that are very similar between those two species as far as drug use goes. Avian pathologists have a great stewardship talking points, which is about 5 or 6 talking points just discussing what they want to accomplish in antimicrobial stewardship. And then they also have a document that's core principles that really is probably adapted from the AVMAs, and it just outlines it on a poultry perspective. And they also have a judicious therapeutic use document. And then some of our industry groups, they have programs of their own. So for dairy, the farm program really is very helpful on combating stewardship. They have to have an outline plan within that. And I believe there's a new update coming this year for Farm 5. Beef quality assurance and swine quality assurance both do an amazing job. The BQA is very active. They have really great products of training, and they keep requiring training at least once a year, I believe. But that really needs to be applauded because it's a really great program for cattle producers of any kind, both beef and dairy and veal. Can't forget about veal animals. Um, and that's a really good program for them to be involved in. And they've really been very proactive with it. Swine quality assurance on the same level. And I think all 3 of those programs are very well run. And they really have taken a good and proactive approach to that. Manure management, really, a lot of manure management comes down to state restrictions, but I think some people are starting to realize that manure is a potential possibility for antimicrobials to be released into the environment. either from residual product or from product treating the actual manure system. So it's something that more people are thinking about, but maybe it's not on the high level. We're really focused on the individual animal level, but it could be a lot better, but we're getting there. That seems to be the theme I'm talking about. So what are some ways that we could improve or increase our stewardship or our stewarding of antimicrobials? So we do get some outside pressure from outside of the veterinary industry. The WHO, or World Health Organization, just released their newest update of list of medically important antimicrobials. And it's pretty much what a lot of people that were watching it expected. I'll explain a little bit about that here in a second. EU is really talking about restrictions. Now they have different guidelines over there as far as what they're allowed to use and not, and veterinarians are allowed to give and not. It's much different on the other side of the pond than here, but it's all the same theme. We're also getting a lot of consumer demand for antimicrobial, pesticide, hormone, and additive-free products or reduced use and such nature. So that's kind of one area where we're going to not necessarily have to improve, but kind of just have to hinder to or manage it in an appropriate manner so that we still have our markets, our producers can still be productive. So this is from the recently released list of medically important antimicrobials. I thought I'd put it in here. I thought it was a pertinent topic. And so the one part of it says there is a global need to preserve the efficacy of antimicrobial agents and minimize the risk of antimicrobial resistance because resistance develops and transfers within among all sectors, minimizing the risk of emergence and transmission of resistance calls for a One Health approach. And to improve their responsibility and prudent use of antimicrobial agents, in particular medically important antimicrobial agents, it is thus essential to decrease their inappropriate use across sectors. Okay, fine. We can get along with this. This seems fair. We love One Health. Unfortunately, when I hear doctors talk about One Health, they just think about one human health. It seems to me, even still to this day, not every doctor, I'm not picking on everyone. I think it's better than it used to be, but it's still a little, the veterinarians are always saying One Health, and we'll always meet with the environmentalists and the human doctors, but it seems to be just kind of one-sided at the moment. So we really need to be proactive about reaching out to physicians, hospitals, and AMA and such to give them an understanding of, hey, this is what goes on our side. What are you doing on your side to help with resistance? And I think they acknowledge the problem, but they're not really sure where they need to come talk to us too. The list of the antimicrobials they just released from WHO is a little concerning because a lot of them are listed as critically or highly critically important. And you're welcome to, you can just Google that and it should pop up. That's the first thing on there, but there's a lot of drugs on there that we probably would use in food animal that they think are critically important. A lot of the macrolides are not, which is kind of nice for cattle production, but still we're really limited on what they think is necessary. This statement here is also from the same document, and it was a little concerning. This group also aligns with the WHO best practices statement in the further down in the document that antimicrobial classes are not currently authorized in food-producing animals should not be used in such animals in the future. And so what it sounds like the WHO is saying is that in the future, any new drugs that come out will never be, they don't want to be used in food-producing animals at all. Which I kind of understand, but also like there's a potential to have thousands of new drugs eventually, or not. It takes a lot of money to find them and bring them out. But that's just seems very limiting to us, and don't our patients deserve the best too? That's my personal opinion. But it's just that's why on my committee I have some great participants of that, and they do a great job of following these topics. And it's not just the WHO that are thinking about this in the same way. So let's talk about how we're using products on farm, and what we probably should do to improve that. So currently we really need to think about ensuring how drugs are properly purchased, and are they purchasing the correct drugs? Um, I still have some producers that buy something and I'm like, you don't need that. It's not labeled for your species. I don't know how you got that, but they still have ways. There are also drug regimens. So the drug regimen refers to, one treatment series that's following the specific dose, route, frequency, indication, etc. And so are we increasing our regimens, or are we appropriately using the regimen as it's supposed to be done? Are we implementing protocols in place as well? And are we following the protocols, and is there protocol drift? And then are we implementing programs to address the changes? So say something changes in the protocol on purpose, because something changed on farm. Are we using a system of repercussion in order to correct that, or in order to change the protocol? And so it's something to really think about from a preventive medicine aspect. We could use a system like HACCP in order to make that occur. And there are some really valuable programs that came out for drug use on that specific topic. And so that it's just a good way to think about it. Are we meeting with people that are influencing the use of the drugs on farm? Whether it's a company representative, or the person giving the drug, or the management team, or the owner, or the feed company, something of that nature. And then always have to implement data. We are in the 21st century now, and data seems to be running our lives. But it's really important to collect data so that we can monitor it and manage it. So I think a big area where we really need to get better um, is protocol development. And so protocol development really is going to be really client dependent and even site dependent. So if your client has multiple sites, protocols might be different across them. I've had some particular producers where they want the protocol same on every specific site of their production system. But that's just not physically possible because they have different facilities at each site. They have different classes of animal at each site. And that means that the protocol can't be the same on each farm. It might be for a specific indication or a specific disease, but it's not necessarily going to be just a white paper for each and just blanket cover their whole production system. There's a lot of good options out there. If you don't want to write your own, you can borrow some from someone else. You could take them off of a program like Farm Program for dairy. And there are plenty of those out there. I'm sure by searching online, you could find lots of different ones. The biggest thing is you need to specify it for your particular operation. And it's, it wouldn't be something I would just copy and paste. That would not be ideal. And a lot of the industry groups do have those, but if it's not written down, it's not going to be the best protocol carried out because it's not actually going to get read. Some employees might not even be able to read, or it's in an incorrect language for them, or it's not their first language, so they can't actually understand it. Lots of different issues there. So what are we going to do to address those problems? I think protocol development takes me the longest time because I hate sitting down and writing things. Is the absolute worst thing for me. But I can get it done. It just takes a lot of effort and a lot of distraction, apprehension, so I don't get distracted easily. But it's something very important. And these protocols are really going to drive our drug use, but also not just for antimicrobials, but for other products, for other treatments, depending on your need. Every time. Okay. So I think more assistance or more involvement in these quality assurance programs will be great. So BQA, they also have some other programs from NCBA like stockmanship and stewardship. I think it's really great. The PQA and farm program, like I mentioned before, if we can involve our producers in those programs more, like, hey, so and so does this, would you like to be involved with it? And their neighbors or their competitors or competition, um, it might actually get them involved into it, and actually get something accomplished. Those really have positive feedback, because they really express things that need to be done in order to be part of the program. And then if you're part of the program, you might have a better market outlook for that specific product. Some processors for our food animal products do require certain programs to be followed. Many milk processors require farm program adherence, and there are also auditing programs that need to be in place. And a lot of those are not only for drugs, but for welfare and facilities and such. The biggest thing that a person can do is talk to another person on farm. And I think that's a really important thing to do. The um, I'm not a great Spanish speaker, but I have a lot of Spanish um, employees of our clients. And so I will at least try to talk to them, even if it's just asking them how their day is going. That really makes a great improvement with our morale with the employees as we're operating on farm. And they're more likely to help me when I'm nice. And I've actually talked to them a little bit, even though they'll start talking to me really way too fast. And then I can't understand what they're saying. But they're usually good about slowing down for me or going to find someone that can translate. I'm not, I know a little bit, but not a lot. But we really need to implement training. If you haven't done that yet, it's really a good thing to start on. And a lot of it is just basic stuff like what is an antibiotic and what is an anti-inflammatory. Um, why do you use one for the as opposed to the other? Those are really pretty easy things, and they really don't take a lot of time. And maybe it's not even a formal meeting sitting down. It could just be while treating cows, while working cows, or you're walking through the flock in a layer barn and you just notice something. You're like, oh, well, the producer, he told me to do this, so I did that. And I was like, well, you don't actually don't need to do that. Or you should do this instead. Those are very simple opportunities. But you can also identify where if they have implemented a protocol, they might have actually drifted from it. So protocol drift can be extremely frustrating as a veterinarian, but also on a management staff. Protocol drift is a nightmare just because usually it happens either because someone's grumpy or they found a better way. They thought that their way was better. There are some other things too, but the it's really has to come back from why did it start? And if you figure out why it started, then you'll actually find a better solution than just trying to say, hey, don't do that. Because that receives a lot of negative personal influence. Um, and then you have grumpy employees, and then things start falling apart or don't get done appropriately in other places. And then they tell every other employee that you yelled at them. So um, it can become a nightmare. And it's important for newer veterinarians to know that we're people doctors, even though we're not physicians. We're still people doctors. So it's really based on people interaction. And it's not just training for the farm staff, it's also training for us and for other consultants too. So maybe we need to offer continuing education for all the consultants in the area to come together and kind of get something new into our brain or something else to think about, whether it's people management or data analytics or something about a new product. All right, let's talk about drug regimens. I think this is a good area for us to improve in, especially in cattle area, because we're still behind on this in cattle. It's a little easier when you're dialing the dose into the water for, say, poultry or swine. But it's a little more challenging when we're treating individual animals because we have big animals and we're not sure if an oral product or a water product is going to get effectively treating that particular disease. So are we giving the proper dose? Is that based on the estimated weight or the correct weight of the animal. And I ask students a lot about how much do you think this cow weighs? And then they usually will say, oh, 1,000 pounds, but it's like a 5-year-old Angus bull. I was like, it's probably not 1,000 pounds. Can you guess again? And they go for 1,100 pounds. And I say, no, 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 think bigger. So those are some um, interesting opportunities. So learning how to estimate weight, but also using things like weight tapes. They are fairly accurate in at least in Holsteins and for some of the beef breeds, you can use a weight tape. If it's a cattle production system, maybe out in cow calf or feedlot, maybe they have a scale that's really helpful. And I'm sure a lot of the more progressive producers have scales because they want to know rate of gain and they want to know if their production system is working. Are we giving the proper drug in the proper way and at the proper time and for a proper amount of time? Those are really things that still fall off the off the bandwagon. Like you didn't give a drug for 5 days in a row. Like you're supposed to give 2 doses of Exceed for metritis. Why didn't it happen? Well, the cow got let out and then she never came back. Okay, well, where'd she go? Well, she's out in the range or she's out in the pasture. Those are problems. So that's really more of educating them why they need to have that second dose. It could be medically important, it could be labally important, and it also could be protocol important. If I emphasize a protocol, they're more likely to follow it. If both I and the manager emphasize the protocol, they're highly likely to follow it. Um, but sometimes they don't always do what I say. They need multiple people to tell them what's going to go on. We still see a lot of drugs that are misused, either for the wrong indication or for the wrong species. And it's sometimes still done by veterinarians too, to be honest. And I'm sure they have good reasoning in their head. But you really need to make sure you're following the drug laws as applied through AMDUCA if it's extra label, or if it's on label, you're still following the label for the correct indication. If it's not an indication, then on the label, then it's technically extra label, and you have to follow through AMDUCA. It's not usually too complicated if it's a very common disease, but if it's something more like pain in cattle, that's a little more challenging. We do have some products now available, but it's still something you really need to work through personally, even though all the smart people told you it was okay. And some classes of animals do require certain products. Um, in that picture earlier, they had both like lactating and non-lactating drugs kind of mixed together in those syringes on the wall. And really they should be separated out as well. Even though it's just their syringe rack, they should really be thinking about it on a lactating and non-lactating basis for that animal class. Or if you had veal animals, need to make sure that that drug's actually labeled in veal, because there's a lot that aren't. Let's see. What else? So for improvement, I think a HACCP plan or something similar to that would be a great way to implement how you're using, how to control antimicrobial use in a particular way. So where are we using it? What are we using it for? What could possibly go wrong? Did we give Exceed in the vein or in the artery or and not behind the ear? Did we use Oxytet IV in the inappropriate manner? Did we give a VFD product extra labelly? All those kinds of things. So if you're going to do that and create a plan, you need to parse out who is in charge of that, who are the compensating people that are in charge of it if someone's gone. What other information do you need to know about that particular drug? Does it need to be stored in a particular way? Is this all written down in the SOP or in a protocol? Some people like to change out SOP and protocol. They can sometimes be different, sometimes the same. It really depends on how you write it. But I think creating a HACCP plan is a really nice way to think about it. You don't have to call it HACCP. Some people have nightmares about HACCP plans. It's really just a thought process and then writing down things on where if this happens, we do this. If this doesn't happen, we do this. Okay. It's just a control mechanism. So it's a good way to think about parsing out how we're actually going to control antimicrobials. So just remember that everyone messes up. Everyone has errors. I love this Latin quote, errare humanum est, to err is human. Okay. So people are going to mess up, and can be a big deal. Okay. But sometimes it's okay. Just take a step back. There's a really big human portion of the antibiotic use on farms. And so I love talking to the employees. I love talking to management. But you need to think about on a system-based approach, who else has talked to that person, and who else has influenced them, because they might be influenced by things that seem okay on the outside, but are actually incorrect on the inside. Um, are the employees happy? Are they satisfied? Are they disgruntled because they had three people leave because they moved away and now they have to do twice as much work and they don't want to give all the shots because they hate giving shots, but they have to because no one else will do it. Something of that nature. Okay. Are there things going on at home that are affecting their life at work? And all of those are really important. So the human factor is highly imperative to the um, outlook of our antimicrobial use on farms. I think data management will be very helpful in the future. We're already really getting this, especially on some more progressive farms. I think they have a lot of data points. They probably have more data points than the amount of money in my bank account. But there's really a lot that we can work with. And even if you're on a farm or a backyard producer, you can still get quite a bit of information off of them. There are even apps that you can use. Like if you have a small cattle herd, you can use that. There's like Herd Boss and such that are just apps that you can use to manage your herd. Even if you just have two goats, you can still monitor. Say I gave this drug and this vaccine on this day, and then I treated it again this day, and then we can go back in the app and look for it there. It could just be on a journal in the office. It could be on the chalkboard or whiteboard on the refrigerator. All of those are fine. And if we're using a computer, might need to make sure they have a backup for that computer just in case something goes wrong or the power goes out and they don't have a generator. If we want to use these drugs appropriately, we need to manage them appropriately. And if you're going to manage something, you need to monitor it. If you're going to monitor it, you need to measure it. One of our very good producers weighs their drugs in their drug room to know how much is there. It helps with inventory control, but it also is used to analyze how much is getting used for treatment or for control in their herd. So some newer ways such as weight of product can actually be very helpful. And obviously there's a lot of error that could potentially go wrong in there. But if you train your staff to use it appropriately, you can do it. It's all about using your system appropriately. So where does the veterinarian fit into this? Obviously they fit into all of it, but specifically, I would like to have the veterinarian think of themselves as the key driver to the stewardship success on farm. We oversee the drug use. We can analyze the protocols for people. We can write the protocols for people. And we can write protocols for other people and then review them for someone else. We can go through the data. We can go through the data with someone else. We can go through it with a consultant. The farmer can go through the data. But we can train people. You'd be surprised how well veterinarians can talk to people, even though they think they're not people. Sorry, that was kind of funny, but a lot of the younger veterinarians tend to think they're going into medicine because they like animals, but you really need to like people in order to have a very positive outlook. I really would like people to uphold their veterinary oath. It seems kind of silly to talk about, but there are some important things in there that make you the key to the puzzle. So we have a major impact on food safety, environmental health, and animal health and welfare. by choosing drugs appropriately, by giving the right drug at the right time. And when you're in a problem situation, finding an expert or even just someone more experienced than you to help you out when you're stuck. So remembering our systems approach, there's a trigger that causes a problem, and then you try to understand that problem either through diagnosis or forensics, and you design a system to fix that, deliver it, and then see how the system performs and sustains that change over time. And that's what a systems-based approach is. And we want to fit that into how we use the system for antimicrobial stewardship and how that's affecting our stewardship practices. So this is what I said earlier, doing the right thing at the right time with the right product and the right knowledge conditions. So do you think we covered the basics of that? I think we did. Okay. I always can have improvement too. So fair enough. We all need improvement. But with that, I think I'm done with the presentation. So thanks for listening. And I think there's a few Q&A
You-
here.
We do have a couple questions if you've got some time, Dr. Jacques.
Yep. I see
Okay.
them in the Q&A there.
The first one is about very early on. You mentioned in your diagram there of all the interactions, delivery of antibiotics by water. Is there any evidence of increased resistance, antibiotic resistance, using that delivery method?
I'm not aware of anything that says specifically using antibiotics in water causes more resistance or less resistance. I think it's more for ease of treatment because it's usually used in a large production system. As far as like environmental effects coming out into wastage, I think that we don't really know. Um, the FDA or CDC, I think, is talking about the waters of the US and sampling for resistance, but there's just so many variables go into that. You can't just walk up to a stream and sample for resistance and say, oh, that's because of this farm up the road. Maybe, maybe not. So it really hasn't been discovered yet. We don't know.
Second question is, let's jump down to the last question. How do you assess protocol drift on your farms? And what are some steps veterinarians can take to assess protocol drift?
Yeah, that's a great question. Thanks for submitting it, Julia. I think when I'm walking on a farm and looking for just assessing what's going on, I just tend to use visual observation. Is that what they're doing? I like to make a schedule, like I'm gonna look or go over this specific protocol each week if I'm there every week, or each month if I'm there like once a month. That's how I'm gonna particularly get it done. So I'm gonna pick something actively. Sometimes you just catch it while you're on farm. Hey, I thought we had written this down, but I saw them doing this when I walked through. I've done it both ways and I've seen it both ways. But for me, I have to be more active about it. I have to push myself to actually look for it or to make sure they're still doing it correctly.
You talked about veterinary students having difficulties in estimating weight of large animals. Do you have a go-to resource that you direct producers and veterinarians to for estimating weight based on age, production class appropriately?
Yeah, so that it's probably more of a problem in cattle because they're so big, but other animals too. So for specific beef cattle breeds, you can go to the breed association and get averages of weights from them for mature animals, and they will have those out there. There are breed specific tapes for lactating dairy cows. You can also ask those breed associations. Average Holstein is between 13 and 1,500 pounds, we think, but it really is farm dependent. So the lactating dairy cow weight tape, it goes around the heart girth, is fairly accurate for Holsteins. I have not used it much on jerseys, but I thought it was okay. It wasn't too bad. It wasn't too far off. Those are places I would start. If you get really bored and want to help us out, in the nationwide approach, you could design weight tape for every species. That'd be helpful. But it's probably not possible for everyone.
You'd mentioned some apps that can be used to monitor herd health. And someone was asking if you had the names of those apps.
The most common one we see around here is called Herd Boss, HERDBOSS. There are a couple others out there that are very similar. I bet if you just typed in like cattle app into your search function on your app store, it would probably find something. But the particular one I know about personally is Herd Boss.
Okay. And then finally, not just necessarily a question, but a comment from a anonymous attendee. FDA 263 enacted last year transitioned over-the-counter medically important antibiotics to prescription only. If feed stores have antibiotics now, they must be registered as a pharmacy. A lot of feed stores decided not to carry them anymore because they don't want to have the responsibility of prescription. It's good to know.
Yeah, that is true. GFI 263 did that. Like I said earlier, if they still have product with the old labeling on it, they're allowed to sell out of it. And once they're empty of their stock, they're not allowed to buy more unless they would become a pharmacy. So if there's still some on our shelves around our area, I think like LA 200 or something, but it's the old label before the change. They're still allowed to sell it. FDA is giving them like a year or two to get rid of their inventory.
Okay. Well, we've gone over our hour and we're done with the questions. So I want to thank you, Dr. Jacques, for a very engaging presentation on this topic. We definitely appreciate your support of the ACVPMC webinar program. A plug for that program. We can't do it without volunteers like Dr. Jacques today. So if you are interested in presenting something to our CE webinar program, you can contact the American College of Veterinary Preventive Medicine. You can email me at admin@acvpm.org, and I can send the Continuing Education Committee your proposal, and we can get you on the schedule. So with that, again, I want to thank Dr. Jacques very much for his support. I want to thank everyone for their attendance and keep an eye out for the next webinar. I believe it's scheduled for the end of April. So keep an eye out. We'll be announcing that in the next week or so. Everybody have a wonderful day wherever you are in the world. Thanks. Bye.